57-year-old male here for pain primarily at the distal triceps, going on for a couple months. He's pretty avid weightlifter, does triceps, overhead type lifting, which seemed to have triggered the pain. He actually fell today backwards on a metal surface and hit the back of his elbow, having more pain where he usually has pain. We did an x-ray today, which I don't think shows an acute fracture, although he does a little bit of a cortical step off of the radial head, which I think is chronic from a spur that he has. Does not have an effusion, which goes against the fracture. So we're just going to look at the back of his elbow today, see what his triceps tendon looks like.
Here we're going to focus on upper extremity anatomy, focusing mainly on the triceps tendon, where here you can see the lateral head of the triceps tendon. Now rotating posteriorly, you can appreciate the long head, which originates from the scapula, whereas the lateral head originates from the proximal humerus. Here we can see the distal triceps tendon. There's a significant amount of anechoic signal and thickening of the distal triceps tendon consistent with tendinosis and at least intermediate grade tearing, it appears, of the distal triceps tendon. Mostly in the long head it appears, as the probe is somewhat medial. You can see some intact fibers going across, so you don't want to mistake tear for anisotropy, which again is an artifact where the tendon appears black, but it's just an artifact as the angle of the ultrasound beam is not square on the tendon. Here again you can see some thickening and irregularity of the distal triceps tendon consistent with tendinosis and tearing. There's no obvious stump, however, going against a full thickness tear. Here we're going lateral, and you can actually see a fairly intact lateral head of the triceps tendon as it's attaching on the olecranon, and you can appreciate the intact medial head as well. Here now we're going to look at the triceps tendon in an axial plane. You can see the triceps tendon, which is the convergence of the long lateral and medial head. The medial head at this point is mostly a thick muscle underneath the long and lateral heads. Here again you can appreciate some of that dark signal and thickening of the tendon, mostly on the underbelly and mostly medial, but it doesn't seem as bad on the axial views as compared to the sagittal views. Here we're just looking at an inflamed olecranon bursa. You can appreciate some synovitis within the bursa as well.